Thank you. Thank you, County Council, for having us here. My name is Brian Corson with MVP Recovery, and I want to first start off by thanking Sophia for coming and sharing your message tonight. Advocacy of breaking the stigma when we talk about behavioral health is so important, and for people to have the courage to stand up and share their personal journey makes all the difference, so thank you. And, I'm so excited for us to be able to come up here and present about Delaware County's ConnectED program, because so many of the things that Kate was identifying of what is needed when it comes to being proactive and preventive, we have started here in Delaware County through the ConnectED program. A couple years ago is, through the Healthy Schools, Healthy Communities Initiative, identifying the survey of what schools needed as far as youth behavioral health, and Delaware County Council coming together with the District Attorney's Office and creating this program. And we have had so much support from Shannon and the Department of Human Services for really getting this out there. As was talked about tonight, Sophia talked about some of the statistics right here in Delaware County. Mental health, individuals that are dealing with mental health, it's not an outlier. When we talk about it, almost 50% of youth throughout the United States report having a severe mental health issue at one time or another in their life. And when we talk about the ability to be preemptive, to be proactive, that is the difference with this program. Here at MVP Recovery, we serve adults, and working with adults, we know how many adults had started down the line of substance use or were having mental health issues years before that they engaged in any kind of treatment or hit the age of 18. And being able to work with our community stakeholders in engaging and working with children makes all the difference. And we're really excited to share what this program has done and evolved into in the last year.
Good evening, Council. My name is Kayla Taylor, and I am the Program Coordinator of ConnectED. And like Brian just said, we are a proactive and preventative program, making sure that no adolescent in Delaware County gets told no when they're trying to be engaged with behavioral health services. Any Delaware County resident can access this program, and we're here to bridge the gap between the schools, parents, community members, and the behavioral health system here. We are removing barriers and accessing treatment while supporting families and students along the way. We are providing parents and educators and the students an ability to talk to somebody 24/7. Regardless if it's 3 p.m. or 3 a.m., there is somebody there that's going to help that individual get treatment. We are also helping that family along the way. We are doing 24/7 follow-ups, and we are doing that continued support for that family to make sure that they are successful within the community.
So the Delaware County ConnectED program really follows the comprehensive no wrong door approach. When this program was originally created, it was focusing on the schools and linking with the schools if they had students that had red flags for any behavioral health issues, whether it's mental health, whether it's substance use. As Sophia talked about, individuals that are experiencing mental health issues are twice as likely to pick up alcohol and other addictive substances. So it's so important to address this early on and be preventative. What we saw with that no wrong door approach is expanding this, just like we've had the opportunity to expand all the other warm handoff programs in Delaware County outside of hospitals, outside law enforcement agencies, to expand ConnectED from the schools, but knowing that it's important to engage with families as well, right? We're coming up on summertime, schools are going to be out. Do family members throughout Delaware County know that there is a 24/7 hotline, a program that can help navigate them if their children are having any issues this summer when it comes to behavioral health? One of the things that we're really engaging with, we had a CIT training this morning, is working with police agencies. Kayla has really taken the initiative to incorporate ConnectED with the District Attorney's LEDI program, because one of the things we talk about is if we're arresting an offender for substance use and they're getting incarcerated or we're sending them to treatment, do they have children at home? And if those children are at home, is that a safe, supportive environment? Who's talking with those children? Who's supporting them? Because we know how important it is to break the cycle. If we can work with those individuals at 7 years old, at 14 years old, that gives them the opportunity to not be getting arrested 10 years later, to not be a client here at MVP 10 years later, to engage early on, because it's about breaking that cycle. And Kayla and her team has done an excellent job connecting not just with schools, but with police agencies, with probation and parole, with CYS, to talk about if we have parents in treatment receiving supports, is anyone following up with the children? And I think as we move to the next slide, we can see how those numbers have trended in doing that outreach and engagement. Yeah. So if we look in 2024 at the basis of this program, and just like our other warm handoff programs, it always takes pounding the pavement, setting the foundation, knocking on the doors, getting the words out, getting positive experiences out there, that word of mouth. In 2024, we had a total of 66 engagements, and we had linked 67% of them to services. And now as we look at 4 months into 2025.
So far in 2025, in the first 4 months, we have had 118 engagements. With those 118 engagements, we have linked 86% of those students to services. That other 14%, we're continuing to follow up, to call, to make sure that they know that there is support within Delaware County within the behavioral health world.
So as we look at those numbers, that is a testament to Shannon, the Department of Human Services, and the support that we get from County Council and the DA's office and the Department of Human Services of opening some doors with some agencies that we otherwise wouldn't have gotten in. So we appreciate everybody's collaborative support in this program. And as we look at the 86%, that success rate of linking individuals to services, that was by individuals that are in the ConnectED program on the front lines identifying barriers. And one of the barriers that we identified was children that are on state insurance, some of the most underserved communities in the county. There was a multi-month waiting list for them to get with agencies that accepted state insurance and provided mental health adolescent care. So one of the things in January of this year, MVP opened up an adolescent program right down the street here in Media to fill that gap, because it is so important and critical that when somebody's calling that number, that they're getting that help in real time. And as you see from that 67 to 86%, because when we engage in real time, it increases the successful outcome of helping that person. Nobody should wait days, weeks, or months. If somebody needs help, they deserve to get the help in that moment. And through the Delaware County ConnectED program, that's exactly what is going on. So we really wanted to emphasize that as we're coming into the summer months, that this program is available for any Delaware County resident that wants to reach out, looking for support, looking for guidance, or just ask a question. Sometimes navigating the healthcare field, let alone the behavioral healthcare field, is difficult for somebody that works in it, let alone somebody that is doing this for the first time. So you can reach out and talk to us, and when you're calling us, you're not talking to an operator on the other end. You're talking to a certified peer specialist. This is a person that is in recovery from mental health themselves, and this is somebody that on the other end of that phone can talk about their experience, how they had gone through what that individual is dealing with, and how they can take their hand and help walk them through this journey, offering that peer support. Thanks for having us tonight.